class. My name is Katrina.
I'm Summer.
And my name's Chris.
And the drug that we're covering is misoprostol, also known as Cytotec, and it is a prostaglandin E analog.
And the objective of our video is for patient safety and medication error reduction.
Alright, so our drug is misoprostol, also called Cytotec. It is a prostaglandin E analog. The expected pharmacological action is that it protects the stomach from NSAID mucosal damage by increasing the gastric mucus production and bicarbonate secretion. It also promotes vasodilation to maintain submucosal blood flow, and it also inhibits gastric acid secretion caused by acidic foods, coffee, and histamines. The therapeutic use basically is to prevent NSAID gastric ulcers. And some complications from it include anxiety, depression, fatigue, constipation, diarrhea, vomiting, headache, abdominal pain, gas, dysmenorrhea, and spotting.
So Cytotec is a risk category X. It should not be administered to women who are pregnant or who plan on getting pregnant. It can cause abortions, premature births, or birth defects. Also, they should be taking a pregnancy test, and it should come back negative 2 weeks before starting therapy. And then it has been reported that it can cause uterine rupture in those who are pregnant and who use it to induce labor or induce abortions. So that was some of the contraindications and precautions. Also, if they're going to be on this medication, they need to be on contraceptive measures. So some interactions would be the drug-drug use, magnesium-containing antacids increase, and misoprostol induces diarrhea. Some evaluation of medical effectiveness to look out for would be reduced frequency or absence of GERD manifestation, absence of GI bleeding, healing of gastric duodenal ulcers, and no reoccurrence of ulcer. So according to the FDA, the overdosage of this medication presents sedation, tremors, convulsions, dyspnea, abdominal pain, diarrhea, fever, palpitations, hypotension, and bradycardia.
Alright, so to go along with Cytotec, per ATI and the FDA med administration, Cytotec is a PO med. It's given through tablets, and there's two dosages. There's 200 micrograms or 100 micrograms, and if the patient can't tolerate 200 micrograms, then it's lowered to 100 micrograms. Usually the medication is given 4 times a day, usually after every meal, and then 1 more time at bedtime. The medication also should be taken with food, or can be taken with a glass of milk, and should always be taken with a full glass of water. Now, some nursing interventions would be that female patients should always be screened for pregnancy to make sure that they're not pregnant prior to getting this medication prescribed, and they should be cautious with the drug. And then patients who have epilepsy or coronary artery disease or cerebrovascular disease should also be careful with Cytotec, because it can be harmful or it can be dangerous. And then some client education would be obviously not for pregnant women, because it's a category X, to try to take the last dose at bedtime, to always make sure that food is included, and that it can cause diarrhea, so it's important to let the patient know that that can be one of the side effects. The medication should also not be shared with anyone. Anyone who has any ulcers cannot take this medication, because this is specific to the patient that it's given to. You want to avoid the antacids that have magnesium specifically, but you want to try, if you need to take an antacid, then you can take one with aluminum or calcium in it preferably, which wouldn't really go against the drug. After menopause, it can cause postmenopausal bleeding in women, so that's something to look out for. When you're storing this medication, you want to store it in a dry, dark place at room temperature. You want to keep it away from moisture, and you want to make sure there's no light. Also, keep it out of children's hands. Store it in a place where children can't access it. If you have symptoms that are side effects, that are negative side effects, and they've been going on for at least 8 days, you want to contact the doctor or provider to let them know. And if you miss a dosage, you want to take it, you don't want to take the double dose, so you want to wait until the next dosage is due, and you never want to take 2 at a time because that could be detrimental also. So those are some of the safety and errors that go along with Cytotec.